Hi, I'm Dr. Ty Vincent. In this video, I'm going to talk to you about how I choose an antigen for somebody when starting with LDI, with low-dose immunotherapy. People wonder that a lot. Previous video, I talked about how I do not use laboratory testing for this. And when I talk to doctors in particular, but also professional patients who have been to dozens of doctors, they're just baffled by the fact that I don't want to do tests or I don't want to look at the tests that have been done. The reason for that is that it doesn't help. It doesn't give me the right answer any more often than rolling dice does, because for reasons I explained in that other video. So what you do to figure out what to try for the person is what we're all taught to do as doctors or as practitioners, and you ask a lot of questions. You get what's called the clinical history, okay? That takes a lot of time, and it takes a lot of detail, and it requires a dynamic conversation between me and the sick person or whoever's caring for them. You have to ask questions in different ways until you're satisfied that you know the right answers, because the person themselves often doesn't even know what information I require in order to figure this out. So it's interesting. It's like interrogating somebody who wants to help you, and yet they don't even know what the right information is. So there's a lot of skill and art to asking questions in a way that gets you the right answer. You can't accept superficial answers or answers that are ambiguous. So I spend a lot of time just asking a lot of questions, going back to the beginning. What helps me is to get the person's life story of illnesses chronologically, if possible. So did you have problems when you were born? Were you colicky? Did you have rashes? Did you end up with serious diaper rash a lot? Were you in and out of the doctor's offices with ear infections, bronchitis, strep throat over and over again? As you got older, did you have eczema? Did you have asthma? Did you have hay fever? Did you have identifiable food allergies? Did you have hives? Did you have recurring urinary tract infections? As a teenager, did you have asthma or did you have acne? Did you end up with migraine headaches? If you're a girl, did you start having horrible problems with your menstrual cycles after they started? All of that stuff is often related to the immune system, at least in part, and sets the tone for that person's life and illness pattern involving the immune system. And I know that just because I've interrogated hundreds and hundreds of people with these problems, probably thousands of people by now. And it's just a matter of asking questions and hearing stories. It's all about the story, is what I tell people, to put it simply. I need your story. Getting your story written down, turns out, isn't very good. It really, like I said before, has to be a dynamic give and take. When you tell me something and use a given word, I need to be able to immediately ask you what that word means to you. Because one of the annoying things about verbal communication is the whole "you know what I mean" phenomenon. People say a word and it means one thing to me, it doesn't mean that to them. So I've learned to clarify, and I've learned to get a lot of specifics. So people will often submit to me a written medical history, and I use that in the chart as a reference in the future, but I don't use it to make decisions up front. I have to go through it with them. I have to be able to ask questions in real time. And that's really critically important. It's indispensable. There are no tests that will supersede any of this. And every doctor is trained how to do this. We're all trained how to take a history. It's just time consuming. So a lot of my colleagues, a lot of doctors, they start leaning more and more on laboratory testing, more and more on specific things as they go, looking for a starting point. And really what we're all looking for is a starting point. Okay, so I'll give you a common scenario or example. If I have a woman whose diagnosis, and incidentally, a diagnosis is one of the least helpful things a doctor will ever give you. It doesn't help you at all, unless that diagnosis always has the same discrete cause and the same discrete treatment that works every time. And that's exceedingly rare, okay? So a diagnosis is a starting point for helping a person. It's not the end. In allopathic medicine, and I'm an MD, the shirt's ironic, okay, if you haven't figured that out. In allopathic medicine or classical MD-DO, we're taught to make a diagnosis and then we're basically done. You give the prescribed treatment that was taught to you by the drug companies in most cases, okay? But in reality, a diagnosis is not the answer. I'll give you an example that I gave at a conference recently talking to parents with autistic children. So I used the example of corn allergy, okay? If you have 6 people in front of me that all have corn allergy, one of them might have diarrhea as a symptom, one might have migraines, one might have joint pain, one might have eczema, one might have asthma. So do they have 6 different diseases, and do they need to see 6 different doctors a neurologist, a gastroenterologist, a pulmonologist, a dermatologist? You know, is that what they need because of their diagnoses? No, they all have corn allergy. So how do you figure that out? How do you figure out, what if you have one person who has all of those conditions together? You have to ask them, hey, are there any foods that make this worse? You know, are there any environmental situations that make this worse? When did it start? What was going on for you then? What have you tried to do about it? And was that helpful or not? Okay? Those are the relevant questions. You don't just say, oh, I did pulmonary function testing, you have asthma, here's a steroid inhaler and some albuterol, and I'll see you in 6 months. That is bad medicine. I know, because that's the way I was taught to practice medicine. That sucks, all right? Asthma is almost always an allergic disease. I should be able to make asthma go away for everybody that I talk to, okay? You can't just settle for these endpoints that are false. Okay, end of that tangent. So fibromyalgia, let's say I see a woman who's been diagnosed with fibromyalgia, and I've seen 1,000 of you, okay? This particular woman says, you know, I have just this chronic fatigue that's debilitating. My brain doesn't want to work for me, you know, and I have just achy, stiff muscles, and nobody knows why. Because that's what fibromyalgia is, okay? Fibromyalgia is a diagnostic label comprised of that set of symptoms. So let's say this woman says, I was completely fit and healthy. I was running marathons. I never had a problem in my life. And then I was hit by a car when I was on my bike, and I had a really prolonged recovery, very stressful, lost my job over it, and you know, whatever else. And then I just never recovered. I've always been fatigued and all these things ever since then. She could have burned out her adrenals because of all that stress and the trauma and the injury. She could have developed an inflammatory reaction to virtually any immune target because it's very non-specific when you have that kind of stress encountered, right? So that person's going to be a bit of a mystery, but you want to evaluate their DHEA and their cortisol and look for adrenal stuff. There's things you want to look at that tie to that story. Now let's take another story that's very common in the people I work with because they're mysteries to their doctors. So it's a woman who had recurring urinary infections as a kid, and they couldn't figure out why. And she was given antibiotics over and over again, even as an infant, for other infections, bronchitis, ear infections. She got a lot of antibiotics. And then she ended up with horrible diaper rashes that just would never resolve, made her butt bleed. As a teenager, she developed horrendous menstrual cramps and pain when her period started, and she was eventually diagnosed with endometriosis. Then in her 20s, she had yeast infections constantly, and she would have what seemed like urinary tract infection symptoms, yet every time she got tested, there was no bacteria there, no UTI. And she's just been like that. And then in her 30s or 40s, she managed to have a family, second or third child. After that, everything went to hell. After the second or third kid, now she's just exhausted and can't function, and her brain doesn't work, and she hurts all over, and nobody knows why. And maybe she no longer has yeast infections, you know, vaginal yeast infections. Maybe she no longer gets UTIs. Maybe none of that past stuff exists anymore. Common comorbid symptoms, this is a woman who reacts to yeast. Okay, I'll give it away. And I hear this story over and over and over again from women. It's a very common scenario. Elements of it, at least. Maybe not everything in their story is the same for every woman. But what you get is you get a switch phenomenon with the immune system. So early on, she probably had food sensitivities or some other thing, or just helicopter parents who gave her antibiotics every time she snorted. And then she ended up with yeast problems because of antibiotics. And then that started with recurring urinary symptoms, and then menstrual problems and uterine problems. Endometriosis is virtually always a yeast symptom in every case. It just is equivalent to yeast hypersensitivity syndrome. And then she ended up with interstitial cystitis symptoms, and then she ended up with maybe chronic bloating, gas, constipation, irritable bowel syndrome. That's often a yeast-related issue too. And then eventually, something shifted her immune system again. In this case, it was birthing her second or third child. And then her immune system just kind of started to attack her in general. Okay, and she has chronic systemic inflammation. And if I'm going to treat that woman with the yeast LDI mixture first, even though there are other things that cause those symptoms. So that's how you figure it out. You have to get all the elements of the backstory, put it together, and I could stand here for 10 hours giving you scenario after scenario after scenario that I hear commonly. And now it doesn't usually take me very long to get the key elements of the person and have a good list of 3 or 4 antigens, you know, is what I try to figure out. What are the 3 or 4 things that sound most likely? And then you go through them one by one and figure them out. Okay, so in the next video, what I'm going to talk about is choosing a starting dose. So it'll link to this one. I'll wear the same shirt just so it's easier for you to follow. Because now we're talking about, in this case, a woman we're going to use yeast for. So then, where do you start? And we'll talk about that here shortly.